For many men over 50, concerns about sexual health quietly grow in the background. Changes in hormone levels, circulation, and tissue elasticity can affect not only performance, but also the appearance and size of the penis. According to urologists, part of this change comes from reduced blood flow and the gradual loss of collagen and smooth muscle fibers within the penile tissue. The result? Shorter, softer erections and a noticeable reduction in girth and length over time, even without any underlying disease. Dr. James Carter, a board-certified urologist with over 25 years of experience, explains that the solution isn't found in expensive pills or risky surgeries, but in targeted exercises that improve circulation, strengthen pelvic floor muscles, and stimulate the tissue to maintain its elasticity. Most men don't realize, he says, that just 5 minutes a day can have a measurable impact on penile health and appearance, even if you've passed 50. The principle is simple. Increased blood flow nourishes the tissue with oxygen and nutrients, while light mechanical stimulation signals the body to maintain structural proteins like collagen and elastin. Over time, these adaptations help restore both firmness and visible size. This isn't about miracle growth. It's about reclaiming what age has been quietly taking away. If you want to learn this urologist-recommended 5-minute routine and many other science-backed ways to protect your sexual health after 50, make sure to subscribe to our channel and turn on notifications right now. The next chapters will guide you step by step through the exact techniques, their benefits, and the real results you can expect. The first step in the 5-minute daily routine is the warm-up stretch, a gentle yet effective way to prepare the penile tissue for improved blood flow and flexibility. Just like any other muscle or connective tissue in the body, warming up helps reduce the risk of micro tears and maximizes the benefits of the exercises that follow. For men over 50, this step is essential because the tissues have naturally become less elastic with age. To perform the warm-up, start by soaking a soft cloth in warm, not hot, water and wrapping it around the penis for 2 to 3 minutes. The heat dilates the blood vessels, allowing more oxygen-rich blood to flow into the area. This increased circulation also helps relax the smooth muscle fibers, making them more receptive to stretching. After the warm wrap, gently hold the penis just below the head and stretch it forward until you feel a mild tension, never pain. Maintain this stretch for 20 seconds, then release. Repeat the motion in different directions, upward, downward, left, and right, holding each position briefly. These multi-directional stretches help improve overall flexibility and maintain the length potential of the tissue. When done consistently, the warm-up stretch not only primes the penis for the rest of the routine, but also begins to combat the tissue shrinkage that can occur from years of reduced use and blood flow. It's the foundation for the rest of the exercises, ensuring your results build safely and effectively over time. The pelvic floor muscles play a critical role in sexual function, erection strength, and urinary control. Strengthening these muscles can significantly improve blood flow to the penis and help maintain firmness during arousal. According to urologists, targeted pelvic floor exercises, commonly known as Kegels, are one of the most effective non-invasive ways to enhance penile health after 50. To locate your pelvic floor muscles, try stopping your urine mid-flow. The muscles you engage are the ones you'll be training. Once you've identified them, you can perform the exercise anywhere without anyone noticing. Simply contract these muscles for a slow count of 5, then release for a count of 5. Start with 10 repetitions, aiming to increase to 20 over time. It's important to focus on proper form. Avoid tensing your abdominal, thigh, or buttock muscles, as this can reduce the effectiveness of the workout. Keep your breathing steady and relaxed. For best results, perform this exercise twice a day, once during your 5-minute routine and again at another convenient time, such as before bed. Over weeks of consistent practice, pelvic floor contractions can help you achieve stronger, longer-lasting erections, and better control over ejaculation. They also contribute to better circulation in the pelvic region, supporting overall penile health and size maintenance. Combined with the warm-up stretch, this creates a powerful foundation for the rest of the daily routine. The third step in the routine is designed to temporarily increase blood volume within the penile tissue, encouraging expansion and nutrient delivery to the smooth muscle fibers. Urologists refer to this as a vascular pump effect, a safe, controlled way to mimic the natural rush of blood that occurs during arousal, but without relying on sexual stimulation. To perform the blood flow pulse technique, start in a relaxed, semi-erect state. Using your thumb and forefinger, form a loose, OK ring at the base of the penis. Gently but firmly push the ring forward toward the head, stopping just before the glands. This motion moves blood from the base into the shaft, creating a mild engorgement. Release and repeat in slow, steady pulses for 30 to 45 seconds. It's essential to maintain gentle pressure, never squeezing hard enough to cause pain or restrict circulation completely. The goal is to guide the blood forward, not trap it. This technique should feel like a massage that gradually warms and fills the tissue, not like an aggressive grip. Practice consistently. The blood flow pulse technique can help counteract the gradual narrowing of penile blood vessels that often occurs with age. Over time, this increased vascular activity can support firmer erections, better sensitivity, and the preservation of both length and girth, making it a vital component of your 5-minute routine. Controlled tissue expansion is a gentle technique aimed at improving the elasticity and capacity of the penile tissue. Over the years, reduced erections and limited blood flow can cause the tissue to adapt to a smaller working size. This exercise encourages the fibers and supporting structures to stretch safely, allowing for greater expansion during natural arousal. To perform it, begin in a semi-erect state, firm enough to feel resistance but not fully erect. Hold just below the glans, head, with your thumb and forefinger and slowly pull forward until you feel mild tension along the shaft. Hold the stretch for 20 to 30 seconds, then release. Repeat the movement in different directions, upward, downward, left, and right, holding each position for the same duration. The key here is patience and consistency. This is not a forceful pull, but rather a steady, measured stretch that gently challenges the tissues to adapt. Overstretching or using excessive force can damage the delicate blood vessels and connective fibers, which is why slow and controlled movement is critical. When combined with the warm-up stretch and blood flow techniques, controlled tissue expansion helps maintain the maximum potential size your body can naturally achieve, while supporting healthier erections and better overall penile function. Over weeks and months, this gentle conditioning can reverse years of gradual shrinkage caused by aging and inactivity. While each exercise has its own specific benefits, the true power of this routine comes when they are performed in sequence as one continuous 5-minute session. The goal is to prime the tissue, increase blood flow, stretch and condition the fibers, and finish with a strong oxygenation phase, all in a compact, easy-to-follow structure you can do daily. Begin with exercise number 1, the warm-up stretch for 1 minute, alternating directions every 20 seconds to prepare the tissues. Move immediately into exercise number 2, pelvic floor contractions for another minute, focusing on steady, controlled squeezes and releases to activate the support muscles. Next, spend about 45 seconds on exercise number 3, the blood flow pulse technique, then flow into exercise number 4, controlled tissue expansion for about 1 minute and 15 seconds, making sure to rotate directions. Finally, finish with exercise number 5, the oxygenation hold for the last 45 seconds, creating those short bursts of blood pooling and release. When done in this order, each exercise builds on the last, ensuring that you're maximizing circulation, flexibility, and tissue health in the shortest amount of time possible. Over weeks and months, this simple daily habit can deliver visible improvements in size, firmness, and endurance, without the risks or costs of more invasive methods. One of the most common questions men ask is, how long before I see results? According to urologists, improvements begin subtly within the first few weeks and become more noticeable after consistent practice over 2 to 3 months. The earliest changes are usually functional rather than visual. Better erection quality, increased firmness, and greater control during intimacy. These are signs that circulation and muscle tone in the pelvic region are improving. By the 6-week mark, many men notice reduced shrinkage when flaccid, as the tissue is better oxygenated and more elastic. Some also report a mild increase in girth during erections, which comes from improved vascular filling rather than permanent tissue growth. This is a realistic and healthy sign of progress. After 2 to 3 months, the cumulative effects become more visible. The combination of stronger pelvic floor muscles, healthier connective tissue, and enhanced blood flow can lead to measurable changes in both length and girth when erect. Just as important, many men experience a renewed sense of confidence and vitality, which positively impacts their overall well-being. It's critical to remember that results vary depending on age, baseline health, hormone balance, and how consistently the exercises are performed. This is not an overnight transformation, but a gradual restoration of function and appearance. Consistency is the deciding factor between minimal changes and significant, lasting improvements. While the 5-minute daily routine is safe when done correctly, many men unintentionally reduce its effectiveness or risk injury by making common mistakes. The first is using excessive force, especially during stretching or tissue expansion exercises. The penile tissues and blood vessels are delicate. Applying too much pressure can cause micro tears, bruising, or reduced sensitivity. Always aim for mild tension, enough to feel engagement, but never pain. Another mistake is skipping the warm-up. Just like you wouldn't lift heavy weights without stretching first, beginning penile exercises without heat and gentle preparation can lead to strain and discomfort. The warm-up stretch increases elasticity and prepares the tissue for the movements that follow. Omitting it is like building on an unstable foundation. Some men also perform the exercises inconsistently, expecting quick results without committing to a routine. Consistency is far more important than intensity. Short, correct, daily sessions yield better long-term benefits than occasional, aggressive workouts. Additionally, performing the exercises in the wrong sequence can reduce their synergy. The order provided by the urologist is intentional to maximize blood flow and tissue adaptation. Finally, it's essential to monitor your body's feedback. Any sharp pain, discoloration, or prolonged numbness is a signal to stop immediately and rest. In such cases, skipping a day or two allows the tissues to recover. Remember, the goal is gradual improvement, not forcing rapid changes. Respecting your body's limits ensures you'll see results without setbacks. Once you've completed several months of the 5-minute daily routine and started seeing results, the next step is transitioning into a long-term maintenance plan. This ensures that the gains you've achieved in firmness, size, and confidence remain steady as you continue to age. Most urologists recommend maintaining the exercises at least 3 to 4 times a week once you've reached your desired level of improvement. The key is to view this routine not as a temporary fix, but as part of your ongoing self-care. Just as you might lift weights to keep your muscles strong or walk daily to support heart health, these targeted exercises keep the penile tissue, pelvic floor, and blood vessels functioning at their best. The benefits go beyond appearance. They include better sexual performance, improved circulation, and enhanced overall vitality. You can also pair the routine with healthy lifestyle habits to maximize its effects. Maintain a balanced diet rich in protein and antioxidants, stay hydrated, manage stress, and keep your testosterone levels in a healthy range. All of these factors contribute to maintaining erectile quality and tissue health well into your later years. Ultimately, this journey is about reclaiming control over a part of your life that many men assume is out of their hands after 50. By committing to a few minutes each day, you're investing in your confidence, your relationships, and your sense of self. You've learned the science, mastered the techniques, and now have the tools to maintain them for life. Proof that age doesn't have to mean decline, but can instead be a time of strength, awareness, and renewed vitality.